Hey everyone, welcome back to my channel. For those who are new here, my name is Kelly and I'm a physical therapist. I'm also a certified lymphedema therapist. On this channel, I talk a lot about different treatment options and management of lymphedema and swelling, such as compression garments, exercise, and lymphatic drainage. The other major component of managing lymphedema and swelling is skincare. So in this video, I'm going to share the 10 most important tips for healthy skincare habits for lymphedema and swelling. So we're going to go through these tips pretty quickly, but just remember that although I am a physical therapist, I'm not your physical therapist. These are the most important tips that I use for the general population, but if you have any personalized needs, make sure that you reach out to your doctor or your therapist. So the first tip is to use moisturizer. Dry and cracked skin can lead to openings in the skin, which can then lead to infections. And we know that infections can cause worsening or a flare-up of lymphedema. We always want to make sure to look for lotions or moisturizers that don't have a lot of perfumes or extra chemicals in it. The most popular brands that won't break the bank are ones like CeraVe and Vanicream. You may also look for Eucerin or Aquaphor. All of the ones that are commonly used, I will place links for down below. The moisturizer or lotion should be applied at least once a day, and you want to make sure that they're fully dry before you put your garments on, because the lotions and the oils will break down the garments and the fabrics long term. Not to mention, garments are going to go on a lot easier when your skin is fully dry. Another common option that's used is something like coconut oil. Now I know there's a lot of controversy of not using coconut oil because it doesn't dry. I think it's a great option. It's a clean option. I know a lot of people like that about it. Again, my thing is you just want to make sure that it's fully dry. And because the coconut oil doesn't dry really well, you might want to just wipe off the excess from your skin before you go ahead and put your garments on. The next tip is that you want to avoid any cuts or any injury. Of course, we don't want to do this anyway, but what we're really thinking about doing is avoiding any openings in the skin that's going to lead to that infection risk. And when you have some sort of injury, such as a sprained ankle or an extra bruise, there's going to be a lot more blood flow to the area. That's why you have swelling after an injury. But we know that can back up the lymphatic system even further and lead to worsening of lymphedema. Now, I know no one's trying to get injured and this is easier said than done, but just try to think about small little things that you can do to help decrease your risk of injury, such as picking up any throw rugs, being careful when you're walking on ice, and wearing good boots, and maybe just wearing shoes with good support rather than a slipper. So now this leads into tip number 3, which is if you get a cut or a scratch, to clean it really well. And so we know they're going to happen. Someone is going to get cut at some point. All you need to do is you need to clean it really well with good soap and water, and then put some sort of antiseptic on it, such as Neosporin or bacitracin, and then cover it with a bandage or a gauze or a really good film to keep out any bacteria or infection. From there, all you need to do is to continue to monitor the area. If you see any signs of infection, be sure to call your doctor. The fourth tip is to be sure to protect your skin from the sun. Sunburn is damage to the skin, and so anytime you have a sunburn, you're going to have more inflammation to the area, which can build up the swelling in the area and worsen lymphedema. It's recommended to use a sunscreen with an SPF of 30 or greater, specifically one that may also have zinc oxide in it. These are known to be more effective and safer on the skin. A brand that has been around and using zinc oxide for a while is one like Badger sunscreen, which I have a few of these laying around, but you can also now find some drugstore brand names that are coming out with options as well. Along with wearing sunscreen during the day, you can also make sure that you cover your skin with clothing to keep it protected from the sun. The next step is to avoid any tight jewelry or clothing. The tight clothes can cause a tourniquet to the area, which means the lymphatic system in this area can be restricted due to that tightness and the fluid can't move through. This will cause a backup in the area and can cause worsening of swelling. Now, tight clothing doesn't necessarily mean your compression garments. Compression garments are made with a specific type of fabric and stretch to allow for that comfortable fit. If someone is using a circular knit garment and they're having issues with that tourniquet or that restriction, especially around the ankle area or the wrist area, that is something to talk to your lymphedema therapist about, and you may want to check out something like a flat knit garment or even a Velcro wrap. I will go ahead and put some links down below for all of these types of examples that you can check out further. The same thing can go for jewelry, so if your watch is too tight or your rings are getting too tight, that might be something you want to look at because you may see the swelling get worse below that area that is restricted. The next tip is you want to avoid any bug bites. Yes, like the cuts and the injuries, this is another one that's easier said than done, but you can try to use some sort of bug spray as much as you can to help avoid the bug bites. The major goal with avoiding bug bites is we want to avoid anything that's going to make you scratch your skin. We know that scratching can lead to the opening of the skin and therefore can lead to the infection and then the worsening of the lymphedema or swelling. So we're going to move on to the next tip, which is to avoid extreme temperatures or conditions. Now, if you live in certain parts of the world, I understand this could be really challenging, but we're really thinking about avoiding the extremes, so extreme hot and extreme cold. Not only with extreme cold and wind are you at risk for frostbite, but you're really at risk for that dry skin, which can break the skin down, open it up, and there's the infection risk. When it comes to the extreme hot, we're really looking at the more humid environments because that's going to cause more natural swelling anyways, which can worsen the lymphedema. So if you're in a cold environment, you want to make sure that you're using moisturizer as much as you possibly can. And if you live in a really hot and humid environment, you want to make sure that you're keeping your skin as dry as possible, trying to keep it cool, but also being diligent with your compression and with your manual lymphatic drainage and your exercise. So the next one is using protective gear such as gloves or socks when you're doing an activity that gives you a risk for any skin injury. This can be something like gardening, where it's easy to get scratched by thorns, or when you're walking through the garden, getting scratched up on your ankles and your feet. But it also may be when you're working with tools, when you're sewing, or even when you're washing dishes, or using some sort of chemicals that can cause skin breakdown and irritation, which then again puts you at risk for that infection. So the next one is to be careful with nail cares. I've seen it a few times in my own practice with my patients that a couple people have gotten their nails done, either their toes or their fingers, in a salon, and either they had bad tools that weren't well cleaned, or they cut too deep on the nail bed, and that caused an infection to occur, which caused a major flare-up of lymphedema. If you're doing your own nail cares, you want to make sure that you don't cut your nails too short, and you avoid cutting the cuticles too short as well. You also want to try to avoid any ingrown nails and be really aware of any fungal or bacterial infections. And if you're going to get your nails done professionally, make sure that you go to someone that you trust at a place you trust that's going to use sterile and clean tools. We also don't want you to avoid doing any nail cares just because of the fear of that. We just want someone to be cautious and careful when they're taking care of their nails. So lastly, if someone sees a rash, redness, increased swelling that happens quickly, or they have flu-like symptoms or pain, these can all be signs of infection, which you really want to make sure that you take care of right away. The skincare is essential for both lymphedema and swelling management, but also for overall health. As you probably saw with a lot of these tips, the main thing is to avoid infection. We know that lymphedema puts someone at a higher risk for infection, but also that if someone gets an infection, they're more prone to a flare-up of their lymphedema or even worsening of the lymphedema. And so we just want to be doing anything we can to be aware of that and to take care of your skin as much as possible. When someone works at their skin health, we'll notice that the skin will become more pliable, soft, and supple versus that hard, thick, and fibrotic tissue. Those are signs of really healthy skin, and that will also help decrease your risk for that infection. And when you have that softer and more pliable tissue, we know that you also decrease your risk of the progression of your lymphedema. Now, if this seems like a lot, make sure that you check with a certified lymphedema therapist in your area to get more personalized information and guidance for you. And if you want to see more videos related to lymphedema, oncology, or women's health, be sure to subscribe down below and press the like button if you found this video helpful. Thanks, everyone.